Dr. Belmaker, when we were talking about, when we spoke earlier, we were speaking about some of the lifestyle issues that are relevant to bipolar and can actually worsen it or help it. So many of our viewers are interested in these questions of sleep and exercise and stress and nutrition. Are these things that are relevant to proper care of bipolar illness, and what would you recommend to our viewers about that?
I think it's also important to add folic acid and other vitamins that lower a compound called homocysteine in blood. And so adding vitamins and nutrition is important.
Folate, other B vitamins, or just folate?
Well, folate and omega-3, which is not a vitamin but related nutrition, I think are the ones with the most literature. But I think bipolar patients have changes in eating patterns, and a multivitamin in general is a good idea to add to the treatment, and to get the patient aware that his eating should be regular or her eating should be regular. And the sleep rhythms are a key aspect of stabilizing bipolar disorder. Some practices have psychologists that work with the doctor, not in psychoanalysis of the patient, but in working with the patient in active therapy to stabilize rhythms and reduce stress. A person who's had a bipolar disorder should get back to his life and his work, but should try to choose a profession that isn't too stressful. I wouldn't recommend being a war reporter, an international war reporter, to someone who has had a severe bipolar disorder. Making that statement that I can do anything is not worth the medical risk. And I clearly do not recommend it. And some people will go to another doctor because they don't want to hear that. But I think it's my obligation to tell people to take less stressful work and to avoid family stresses, to try and find compromises, to not buy a big new house that will mean a big mortgage if you've had a hospitalization.
I see. Now you mentioned omega-3 fatty acids, fish oil. Are there guidelines about how many milligrams a person should take a day?
I think the studies vary on the dose, and so and also the content, as you know, the ratio of the components of EPA and DHA in the fish oil vary so much. So we don't really know enough, I think, to make that recommendation yet.
Okay. And regarding the nutrition and diet piece, many people are very concerned these days about things like sugar intake and the inflammatory drive that comes from simple carbohydrates. And you know, there's a lot of research out there, is my understanding, not as a psychiatrist though, that inflammation is important in depression. Do we also think inflammation is important in bipolar illness, and so should similar sort of...
Yeah, I agree with you completely, and as a physician, I think inflammation is important in depression and probably in bipolar disorder, and we want to try as much as we can at the right time in the patient's treatment, at a time when he can hear us and we can hear his family. I wouldn't want to make recommendations that give another reason for the family to fight at the dinner table. But at the time when the patient can hear us, like you say, we want to avoid sugar rushes and avoid simple carbohydrates, and to try and help our patients with bipolar disorder achieve a healthy lifestyle.